Good morning. Thanks for joining us. We're sitting at the Lightning Step couch today. I'm your host, Benjamin Turner, Behavioral Health Advocate. We're sitting down with Mike Giresi with Family First Adolescent Services. We're going to be talking today a little bit about the impact of childhood traumas and adverse childhood experiences on behavioral health. Mike, thanks for joining us.
Thanks for having me.
Really great to see you this morning. So, as we were saying, we're going to talk a little bit about childhood trauma. And specifically, how prevalent are ACEs or adverse childhood experiences? And what categories of experiences constitute childhood trauma?
It's a really good question. I'd say in the residential treatment program that I oversee as the chief clinical officer of, it's very rare to see someone coming into our care with no history of early adversity. The now that original ACEs survey of the
Mhm.
10 questions involving physical and emotional abuse, neglect, sexual abuse, incarceration, loss of a parent, so on and so
Mhm.
forth. The intention of that survey was to be a starting place for us to understand how to correlate this information around early adversity to long-term negative health outcomes. The our understanding of what constitutes adversity
Mhm.
in early life is so much more complex
Yeah,
than those 10
it
questions,
sure
though.
is. Yeah,
The
absolutely.
one of the things that I maybe one little nugget is this thing that abuse and neglect are almost fairly obvious
Mhm.
to most people. There's one particular kind of adversity in early childhood that doesn't get talked about a lot. It's called misattunement.
Oh, okay.
So misattunement essentially is, you know how like when you're in a relationship with someone and they don't quite understand where you're coming from
Yeah, yeah, I'm
on
married.
something.
Yeah.
Yeah,
Yeah,
exactly.
yeah,
So you know this
yeah.
deeply.
Absolutely.
And you know how when they kind of like miss what's happening, it's a little frustrating.
Absolutely.
Well, the idea is that that's about the extent of it as an adult.
Okay.
For a small child whose entire survival is completely dependent on their environment's ability to accurately attune to what it is that they need and feel, misattunement feels
Yeah, I
life-threatening.
can imagine.
And so chronic misattunement in these early stages of childhood development leave a lasting impact on both the developing physiology and psychology of the child that gets carried forward into adolescence and adulthood.
Wow. It's incredibly insightful, man. That's awesome. I appreciate that, man. That's really neat what work you're doing.
Thanks.
Going to ask you another question. So, how can trauma informed assessment tools identify the history of adverse experiences?
I think that they're really useful,
Mhm.
but more often than not, some of these assessment tools coming at it from the front door,
Yeah.
it has limitations basically.
Okay.
That we need to be using them. We need to be assessing things from the very front of care, and yet so much of what people have experienced aren't either uh, held in explicit memory, they're in implicit memory, held in their bodies, or they're held in how they organize their experience
Mhm.
of themselves and the world around them. So, an example, oftentimes, of somebody, me learning what happened to them
Yeah.
in their early life is them telling me what it is that they're most afraid of, because the things that we don't that doesn't come out of nowhere. I
Yeah.
know to be afraid of the judgment of others
Yeah.
because I've been judged. I am afraid of being betrayed because it's already happened.
Yeah.
And so those fears end up being the language that we listen to of understanding more deeply the wounds that people have experienced in their early
Yeah.
lives.
Yeah. So the assessment tools, as you said in the first question, it's a starting point,
Yes.
but there's so much more that you can gather past the assessment. So it's a good starting point, but the interpersonal interaction can help inform it even more.
Beautifully put.
Awesome. Awesome. I really appreciate all the insight, man. I'll ask you one more question, then
Yeah.
I'll let you get back on the floor. Um, how can intergenerational and cultural trauma be addressed in treatment?
I think it's a really big question. It's a
Yeah.
beautiful question, though. One of my colleagues actually specializes in this work. The I think it's helpful from an attachment perspective to understand that there are layers of um, within this larger attachment system
Hmm.
that's intended to support the development of kids. So, the first and foremost is the caregivers,
Yep.
the primary attachment figures, but then it spans outward to the community, and then it spans outward to the culture, and then it spans outward to the larger physical environment. And when we have these disruptions in whether having a global pandemic
Yep.
or a culture that's wrought with historical racism and subjugation and all of these other kinds of ways of objectifying people. And then you have communities and schools that are being impacted by not having enough money and resources. The trickle down effect of all of these, what I call environmental failures,
Yeah.
end up
Great
just
term.
kind of trickling down into the household. Parents are not getting the support that they need. And then, of course, it's going to impact their kids
Yeah. Yeah.
to no fault of their own in many ways. And so I think one of the main things that I could get into just quickly
Yeah.
is understanding how deeply complex that is helps us to have a certain spirit of openness and receptivity to the complexity of the people that we're trying to help, that we can't just reduce down people's symptoms and behaviors to, oh, well, this happened to them when they were little, or their father is like this, or their
Yeah.
mother is like that. It's just not that simple.
Simple. Exactly. Mike, that's been an incredible chat with you. I really appreciate your time.
Thank you so much.
Real quickly, I'm sure you agree that the pandemic has exaggerated a lot of this. Have you seen an increase in need for these services post pandemic?
100%.
100%.
Yeah, skyrocketing.
Yeah.
I think one of the major things of the due to the isolation that all of us experienced in various different forms and ways was we're seeing, especially with the kids that we treat, way higher numbers of self-harm, way higher numbers of suicide attempts, way at the level of shame, guilt, and self-hatred. Because going back to this idea of trauma in early adversity is that children survive their early experiences by blaming themselves for the failures of their environment. And so this global pandemic, how they've internalized this in different ways is starting to come out, but we're not going to know the effects of it for
Years to come.
yeah.
Yeah. Yeah. Absolutely. Well, I want to thank Mike Giresi again for joining us. He's with Family First Adolescent Services, and I really appreciate your time today.
Thanks so
Thank
much.
you. Yeah. Yeah. Awesome.